Hi everyone, welcome back to What's Up Doctor. My name's Dr. Michael Cohen, I'm a family medicine specialist, and today I want to talk about death. Kind of an odd subject, I know, but actually a very important subject as a person and as a doctor. I would start by relating a story that happened when I was 5 years old, and I was sitting next to my father on the sofa, and somehow the subject of death came to my mind, and I started thinking about it and worrying about it. And I said to my father that I was thinking about it, and he told me a story which bothered me quite a lot, to say the least. He said to me that he was probably going to live another 15 years, and he sounded fine with it. And I naturally, as a 5-year-old sitting next to their father, who was only 45 at the time, I burst into tears. And then he told me the story. My father's from India, and when he was a young man in India, as a teenager, he saw a sadhu, which is a holy man, and this person told him that he was going to live until he was 60. So he would be not getting past that age. And somehow my father had internalized this and had come to terms with it and said to himself, well, that's, we'll see if I get to 60 or if I pass 60. But in his mind, he was ready for 60. So I think that thinking about death is very important, both as a person and also in my job as a doctor. As a person, it's important because I think it helps me to gain a perspective on life. It helps me to think and appreciate whatever I have now. By being present in my mind, it helps me to sort of put things into perspective. So I can honestly say that I think about death every day, and I don't mean that in a morbid way. I mean that in a sense of just being aware that it's a part of life, that it happens to us all eventually. Life is a diagnosis with a 100% mortality rate, and how am I going to live my life to the best, and more specifically, how am I going to live my day to the best? Because my time is limited on this earth. So do I want to spend my time doing productive, constructive, fun, good things, or do I want to waste my time? So from that point of view, death is, as a subject and as something to be aware of, is very important, I think. As a doctor, I also have to think about it because obviously I'm seeing patients every day, and quite often I'm confronted with their fears of death, or sometimes they have other fears or anxieties, and very often death or the possibility of death is lurking in the background, and they're either aware of it and they don't say, or they're unaware of it and it holds a kind of a grip over them, because at the end of the day, what does it all come down to? If someone's ill, what does it mean? And if a person is ill, then what implications does that have for their family around them? Or conversely, if they've got a family member who's unwell, then that could be impacting their own life, their own levels of stress, their own illness, let's say. And of course, that makes it very important to have thought about and to feel comfortable with talking about as well, because I think that very often it's a taboo subject. People don't like talking about death. It's considered as though, well, if I was thinking about it, I'm morbid in some way or nihilistic. And on the other side of things, people I think need to be encouraged to talk about it, because we should have all thought about what death means to us, right? Does it mean that we no longer exist anymore? and that, that gives us a kind of feeling of pointlessness in life and meaninglessness. Is it that we are more concerned about the process of dying, that we might be in pain, or we might be in some state that we don't want to be in, not in control of ourselves and of our surroundings? These are the kind of things that are subjects that I think need to be thought about, processed, and discussed. According to Freudian theories, illusion, maybe delusion also, are the creations of an acceptable concept which avoids the recognition of an unacceptable situation. And as people go through their lives, most people deny to themselves that death is ever lurking, and have this illusion, let's say, of invincibility. Well, it's not going to happen to me, or it's far into the future, so I don't need to think about it now. These are defense mechanisms. These are ways in which we avoid the pain of thinking of something. What I'm talking about today is actually to encourage people to think about death a little bit. Again, not from a morbid place, but from one of recognition. And yes, it's a recognition that can come with a bit of a price, but it can also come with some reward. And I'm going to get into that as well. So the fear of death is a very normal fear, and it's always been present in humans. We know this going back to the Egyptians with mummification of their kings, beliefs of the afterlife. These exist in every society and religion. To summarize what people in general are afraid of, as mentioned earlier, it's about the fear of non-existence, the fear of the unknown after death, if there is something after death or not, fearing pain and loneliness of dying, and also meaninglessness, the idea that one may be losing everything that they've gained in life, and as though, well, what was all that for? It's going to die. Another issue that I want to bring up is what modern medicine has done to death, meaning once upon a time death was something very close to people. People at young ages had all been familiar with seeing somebody dying in their family, at home, surrounded by loved ones, sometimes not. But the idea of death was not so foreign and not so distant, and perhaps in a sense less scary, because it was just a part of life. And of course it's still a part of life, but nowadays we have sanitized things. Many people die in hospital rather than at home. And what this does is it also creates another level of fear. It means that people are thinking of, the image of someone dying is in a hospital a lot of the time, rather than surrounded by loved ones at home in the environment that they're comfortable in. It could be that they're connected to monitors and tubes, and we see this all too often on our TV screens, that this is the way to die, that a person's going to die comfortably. The reality is, obviously, sometimes it is like that, and sometimes people do have their family around them, but very often a person may be in a hospital scared, uncomfortable, and often alone, and it could be in the middle of the night when the ward is short-staffed, and their death is surrounded by a lot more fear. It's in the dark. It's not with people who love them, who are close to them. And this is something that I also wanted to bring up in this video, because I think that we can do better. Many of you have probably heard of palliative care, and many of you have probably heard of hospice care. And there's a difference between them. Palliative care is a form of medical intervention that can be employed throughout a person's life. A person could have an illness which is painful, which is uncomfortable, and palliation literally just means to give treatment and care, which is the focus of which is giving the person comfort from their symptoms, but they are still in the process of trying to get better, being cured, being treated. And we often see this with cancer patients who are far from being terminal. Whereas hospice care is when it's being recognized. It's usually when a person is thought to be less than 6 months away from death, and often much less than that. And it's given in a hospice setting, which can either be in a hospice dedicated or it can be in a person's home. So you can have hospice care at home. But the idea of the treatment is to keep the person comfortable, but without any focus on cure. The whole idea is just to keep them comfortable and to give them dignity, and maybe surround them with loved ones and a peaceful environment, because this is really heading towards the end of their life. So what do I mean by doing better? I just mean that we can take away the medicalisation of death. So, of course, when someone is being treated actively, then they're being treated actively, and we're not trying to stop them receiving any medicines. And at no point am I advocating taking away medicines. But there is, if I think back to times when I've seen patients in the hospital, I can recall one that comes very vividly to my mind at the moment, which was a really wonderful elderly gentleman who'd been through a lot in his life. He was actually a survivor of the Holocaust, and he was seen by my team in the hospital, and he had lung cancer, if I recall well. It was quite a while ago now, and we treated him. He got better. He went home. And then a few months later, he came back and he was in a much worse situation. And it was very clear that he was dying. And I went to see him in his bed, and his family was nearby. And he had tubes in him, he had fluids going in, he had a monitor on him, blood pressure. The nurses were diligently doing everything to, by the book to see what his oxygen levels were. And what this did was it kind of created a barrier between him and his family. So his family looked at him and thought, oh, he's got all these monitors on him and we can't touch him, and we might make things worse or something like this. And I actually had a long chat with him and with them, and he was clearly someone who cared immensely about his dignity, and so did the family, and so did the medical team. And so we came to a fairly easy decision that we needed to take off as many of these things as possible and let him feel normal and let him feel close to his family. So I think we kept the oxygen on because it was keeping him comfortable, but we took off the monitoring devices because they were just cumbersome and just making him. It was kind of like a barrier to the family, hugging him. And eventually also took out the fluids, and he was just sipping water, and he died peacefully with his family right around him at the bedside. They were holding him, they were hugging him, kissing him, talking with him, and he was responding, and it just changed the whole atmosphere around the time of his death. And so he went out with dignity. He went out without feeling like that he'd been completely medicalized, that this whole process needed to be this way. So that's just one example that comes to mind of how we can do things a bit better. On another subject, we have a set of criteria that are used for the diagnosis of depression, for example. This is in the Diagnostic Standard Manual, the DSM. And one of these is thoughts about death. So one of the criteria is if a person is having recurrent thoughts about death, then this adds to the weight of how serious the depression is. And very often people have fleeting thoughts of dying or of death. And it's important to get them to vocalize these things. And even people who are not, seriously depressed, but they might just be anxious, sometimes trying to get to the root of that can lead to a discussion about their own mortality, which is a sort of base fear that underlies everybody's lives. And just by talking about it and trying to understand how they see death can be very cathartic. So I've seen many times over the years having a patient who somehow the conversation has gone in this direction and started to talk about it and actually bring it up. And I can't think of a single time that it had an adverse effect. I often remember people feeling relieved to have been able to speak about their fear of death, or about their fear of death of a loved one, or what it means to die, or anything along these lines. And so I do think it can have quite a therapeutic effect, and I think it's a tool that we should be considering using when we see our patients. So I think it's beneficial for people to be aware of their mortality for a number of reasons. One reason is because it allows us to live our lives to the fullest. It allows us to prioritize our goals, to pursue things that truly matter to us, to find meaningful things that we can pursue in life. And I think that this can lead us to a far more fulfilling life. It can also help us to make better decisions, because if we know that we are engaging in things that are harmful to our health, that may bring on our death earlier, meaning we are not in denial of death, but we're very much accepting death, but we just know that we don't want to bring it on any earlier, then it can help us to engage in behaviors that promote a much higher chance that we're going to live longer and healthier lives. And on the subject of living a healthier life, it's very interesting. Many people are highly engaged in healthy activities such as sports, eating healthily, and these things are wonderful. It's great, but sometimes it can become a focus and a way of avoiding actually dealing with death and thinking about death. And I'm not saying that anyone should stop doing sports or stop eating healthily or stop, or go back to smoking or drinking. But it's just an interesting point that it can be that people are suppressing a thought about death. Another benefit of thinking about it is that it can promote gratitude. So really every day we should be saying thank you to whoever, to God, to the universe, to ourselves, for the very fact that we are alive. We are living, in my opinion, in the best period of human history. Most of the world is living in the best period in human history, the most peaceful period, even with all the things that we see on our TV screens. Our lives are multiple times better than they were 100 years ago in this world. And it would be good for us to remember this on a regular basis. And lastly, it encourages us to plan for our futures so we can actually start pursuing our dreams while we still have the chance and while we still have our health. The philosopher Nietzsche once said, "What does not kill us only makes us stronger." And on that subject, I think it would serve us well to be aware of this, because very often we are fearful of things in life, and again, the idea of death and avoiding the idea of death, avoiding things that might be a little bit risky, but which may also have a good payoff for us, is a subject worth thinking about. And that's a very personal thing. Each person can see how it can apply to them in their own life. But very often people avoid taking any chances, and many of those chances could result in them being happier, healthier, or whatever, because the process of doing them involves some effort or pain or discomfort. And so again, this comes back to the idea that there's an aspect of the thought of death and putting it into perspective that can actually be helpful to us in our day-to-day lives. On a final note, and I would like to say this also from personal experience, I think that the idea that all of us are going to die eventually should also prompt us to think about our relationships. We shouldn't be holding back what we want to say to the people that we love, and those might be difficult things, but they're often very good things, very positive things. People sometimes are too scared to tell someone how much they care about them, how much they love them, how much they appreciate them, and very often that could also prompt that person telling them the very same thing. And sometimes, sadly, these things never get said and it's too late. And conversely, it could be a criticism that could help somebody to resolve a conflict between two people that actually care about each other. And all too often you hear stories of people who never actually did that and they regret it. Once the person is dead, you don't have a reproach. You have no time or opportunity to say these things again. And so very often it can lead to feelings of guilt and depression and a feeling of incompletion. So again, this is another point that I think people should be aware of, and go make that special effort to talk to someone you care about. Tell them the things that you want to say. Don't hold it off till tomorrow, because we never know what's going to happen tomorrow. Thanks for watching today. I hope it's been of interest. I hope it's been useful. I hope that you can find a way to apply this to your own lives. I'm talking about this as a doctor. I think that we all need to be a little bit philosophical and a little bit less medical sometimes. If you liked the video, or if you found it interesting, or if you disagreed, I'd be really grateful if you would make a comment below. I do try and respond to the comments. I would also say that making these videos is very interesting for me. I love reading around subjects, thinking about them, discussing them, and quite a lot of time and effort goes into that. And I would be really grateful to everyone here to subscribe, to pass on the videos, to ask others to subscribe, and also to click the little bell to receive notifications for future videos, because there will be many more to come. Thank you.